An ulcer is defined as discontinuity of an epithelial surface of skin or mucous membrane. This is usually progressive destruction of surface tissue cell by cell. Classification of ulcers. 1. Clinical ulcers. 2. Pathological ulcers. Clinical ulcers are classified into 3. A. Spreading, inflamed, edematous, painful. B. Healing, sloping with healthy red granulation tissue, discharge is serous and slight. C. Callous ulcers, floor contains pale unhealthy granulation tissue, shows no tendency of healing. Pathological ulcers are classified into 3. A. Specific, TB, syphilis, soft sore, actinomycosis. B. Milanese non-specific, arterial ulcer, venous ulcer, traumatic ulcers, neurogenic ulcers, infective ulcers. C. Malignant ulcers, malignant melanoma, squamous cell carcinoma, SCC, basal cell co. Life history of an ulcer. The life history of an ulcer consists of 3 phases. 1. Phase of extension. 2. Phase of transition. 3. Phase of repair. 1. Phase of extension. During this phase of extension, the floor of ulcer is covered with exudate and slough and base indurated. 2. Phase of transition. In this stage, the floor of an ulcer becomes cleaner and small red healthy granulation tissue appears on the floor and base induration decrease. 3. Phase of repair. In this stage there is transformation of granulation tissue into fibrous tissue and this fibrous tissue converts into scars and base further decreases. Parts of ulcers. The ulcer has 3 important parts: floor, edge, base. Floor is that part of an ulcer which is seen by observer or exposed surface of ulcer. Edge is the margin of an ulcer. Base is that part of an ulcer on which the ulcer stands and can be palpated. Differential diagnosis. Varicose ulcer, post-thrombotic ulcer, trophic ulcer, tropical ulcer, tubercular ulcer, syphilitic ulcer. 1. Malignant varicose ulcer is a painless, painful callous ulcer typically situated on the medial side of the lower leg. The presence of varicose veins in the upper part of leg of thigh makes the diagnosis clear. Its shape is oval. 2. Post-thrombotic ulcer. It occurs in femoral thrombosis following delivery of an operation. It is painful ulcer and situated on the lower leg. 3. Trophic ulcer, bed sores and perforating ulcers are example of it. 4. Tropical ulcers are due impairment of nutrition which depends on e.g. diabetic ulcer. 5. Tubercular ulcers is due to infection with tubercular bacillus. The most characteristic features of its edge which is undermined. 6. Syphilitic ulcers is caused by treponema. This is venereal ulcer occurs due to sexual intercourse. There are 3 syphilitic ulcers. Hard chancre or primary stage. This usually occurs on the external genitalia 3 weeks after injection. Mucus patches of secondary stage. This usually occurs in the form of mucus patches. Gummatous ulcers or third stage. This is usually caused by obliterative endarteritis, etc. 7. Malignant ulcers, rodent ulcer, epithelioma. These ulcers never show signs of healing but only spread and destroy surrounding tissue. Its shape is irregular. Clinical examination of an ulcers. It includes site, size, number, shape, edge, floor, base, discharge. Investigation, urine examination, blood examination, ESR, TLC, DLC, HB, VDRL etc., blood sugar, urine, bacteriological examination of the discharge, biopsy test, X-ray when an ulcer is situated on bone of joint. Treatment: ulcers can be spreading, healing, chronic. Spreading: proper antibiotics, regular dressing, solutions to treat the slough. Healing: regular dressing, antiseptic cream, grafting if necessary. Chronic: requires grafting of skin. Not responding conventional method of treatment needs amnion. Help in epithelialization, infrared radiation, ultraviolet rays which reduce ulcer size.